All right, if you stumbled across this video because you're Googling or YouTubing what is dry socket, I feel bad for you because dry socket sucks. But I'm gonna try to guide you through this, what it is, how to prevent it. Hopefully you don't have it, how to prevent it, why you get it, how you can help heal it yourself, and how the dentist can help you through your dry socket pain. So what is dry socket? Dry socket is something that really sucks, and this happens typically within the first 3 days after an extraction. What happens is that you have your tooth that's been extracted. Tooth is out, everything's good, and you have a blood clot that forms in that area. And of course, your dentist or whoever's taking out your tooth is telling you all the things you should not do and should do. And maybe you didn't listen to them exactly how you should have. And so you have a dry socket. And what that is the blood clot has actually been dislodged. And that is bad because you have to think about that. If the blood clot has been dislodged, what is exposed? All those blood vessels, those nerves, the bone, all that stuff is now basically exposed to the open air in your mouth, and it's gonna hurt like crazy, and you're probably running around and it's so painful. That is what dry socket is. It's basically the blood clot coming out, and now everything is exposed. All right, so you know you have dry socket. Yeah, you can see the bone, you can see the blood, you can have the intense pain. What are some things that we can do to help you out? Well, come on in, because there's a bunch of different things. We can potentially put some bone graft in that area. Maybe we can suture it up. There's some surgical foam. There's some dry socket paste we can put in there. Sometimes we can numb you up for a bit to help ease the pain just a little bit. There's a bunch of different things we can do to help you out. Maybe irrigate that area. Maybe there's something stuck in there that we just kind of can get out. So there's a bunch of different things that we can do to help you out if you have an intense pain. Just giving you medications probably isn't gonna help that much. You need to kind of help cure that area. So come on in if it is a super intense pain. You're like, but Dr. Nate, I don't wanna come in. I don't wanna come to the dentist. You guys are the one who caused the problem. Well, here's 3 things you can do at home to help you out a little bit. These are just at-home remedies. Number 1, you want to do things to reduce the swelling. So maybe we're going to do hot and cold treatment in that area with just something hot and cold and help reduce the swelling just a little bit. You know, I also do warm salt water rinses. So just like a little itty bitty amount of salt in some warm water, swoosh it around a bit. That is going to help reduce the inflammation as well. And the third thing, which is a little bit different, you can do some tea. You can put a tea bag, which is something, it has these tannins and all these different molecules in them that help alleviate the pain and help reduce the swelling. So sometimes people will just put a tea bag directly on that area. It helps reduce the swelling and helps you out a bit. So you're like, Dr. Nate, I have this dry socket pain. How long is this gonna last? Well, unfortunately, it takes a little bit to heal. Your bone has been exposed. Things are gonna take a little bit to heal. On average, the pain lasts 1 to 2 weeks. It's not gonna be as excruciating as it is at the start, but in general, the pain kind of lasts a little bit, longer than we'd like. But how do we prevent from getting dry socket in the first place? Hopefully, you're gonna see this before you actually get the dry socket. So if you had a tooth extracted, I hope you're watching this because it's very important. You have to think, we are just trying to keep that blood clot there. We're not trying to dislodge it. That's all we're trying to do. So what you wanna do is you wanna avoid sucking through a straw, anything that's gonna cause a lot of suction, because that can take the blood clot out. Anything that's super sharp, imagine like if you ate a Dorito or something, it's gonna go in that area and remove the blood clot. That is not very good. Smoking, smoking's bad. Not only is that cancerous and not very good for you, but you're also using that sucking motion, which is not good. You just want to avoid anything that's going to cause discomfort, like spicy foods or anything that can really hurt that area. You just want to be super gentle. So typically we'll say after extraction, you want to take a day or 2 off. You want to take a day or 2 off to relax and chill out and let everything heal. Once it's healed, then you're good to go. You can resume your normal stuff, but just give yourself those couple days, because if you don't, you get a dry socket and you're watching this, you probably already know this. You're like, damn, I should have seen this earlier. But dry socket pain sucks. So you'd rather just let everything heal and then resume normal activity. All right, guys, that is everything to do with dry socket. Now you know how to heal it a little bit at home. You know how the dentist can help you. But most importantly, hopefully you're seeing this before you get it. You know what you should have done to prevent that. And now you actually know what dry socket is. So once again, it's Dr. Nate here. As you know, I'm putting out videos every single week and I'm trying to answer all your comments. So please comment below. Please subscribe, because I am providing tons of good, useful information, dental and orthodontics related. And I will see you in the next video.